So my patient for this week's note is a 66-year-old male Caucasian, and so he was a reliable historian. He showed up to the clinic alone, and alert and oriented and all of that stuff. So initially he came actually for a physical exam, like a yearly physical, and then just kind of diving into the review of system. One thing that stood out to me was him talking about the fatigue he had been experiencing. So kind of diving into the fatigue more, I came to find out that he really started to notice it around last year, last winter. Basically, essentially a year from now, maybe like December, January is when he really started to notice it. The location is obviously generalized fatigue. How he describes it is he just wakes up in the morning feeling basically not like drowsy, but just tired, and then he has difficulty feeling like he's fully alert throughout the day, essentially. But I mean, he doesn't say necessarily like that the fatigue impacts his work or anything. Like he doesn't take days off because of the fatigue or anything like that, but more so like he just feels like he's tired and he's not able to get as much done. So yeah, basically he characterizes it as being tired, wanting to sleep more. So basically when I started asking more specifically about his sleep, he said he feels like he gets plenty of sleep, usually around 10, sometimes 11 hours. But one thing that stood out to me, I asked him about snoring, and he said he does snore, and occasionally he'll find himself waking up almost kind of gasping for air. And his wife she wasn't sure if he stopped breathing or anything. At least that's what he said. She wasn't in the room, but or she wasn't with him, but he did also say that he gets up typically about 2 to 3 times a night, maybe once to go to the bathroom, and then the other times just kind of waking up, not necessarily gasping, but just waking up. So aggravating, he doesn't really think that anything aggravates his fatigue other than not getting enough sleep, like if he stays up late or something like that. So relieving, he says maybe taking naps sometimes helps. But other than that, hasn't noticed anything. The fatigue is pretty constant most days. And then the severity, he just he feels like it's pretty severe, at least for him. He said he's usually pretty energetic other than that. So the pertinent negatives in the review of systems. So he denies feeling depressed, anxious, any generalized weakness, fever, shortness of breath, angina, palpitations, being dizzy or lightheaded, polyuria, and anuria or edema. But pertinent positives, he did gain, so kind of throughout 2020 and into early 2021, he did gain about 20 to 25 pounds. And he's not necessarily physically active. And then he does wake up in the morning having headaches. And sometimes he says he has some dry mouth and stuff like that. So past medical history or pertinent medical history, he does have hyperlipidemia, hypertension. He had prostate cancer in 2008, which, was obviously, it was removed that same year. And he does have erectile dysfunction. Preventative wise, he has his colonoscopies regularly, up-to-date vaccines and all of that. He had surgery, he had prostatectomy. His only hospitalization was for that. No allergies, medications he's currently on, rosuvastatin 20 milligrams, lisinopril 10 milligrams, Cialis, I guess, 20 milligrams as needed. Family history, pertinent, heart failure, I guess both grandparents and his father had a stroke. He is married, no prior STIs, and then obviously the erectile dysfunction. He denies tobacco, alcohol, drugs. So diet, he does eat out. He still works, and he eats out regularly, about 5 to 6 days a week, and very little vegetables or fruit. Yeah, not the best diet. And then exercise, like I said, he doesn't exercise much, mostly just when he does yard work. Sleep habits, he does get plenty of sleep, about 10 to 11 hours. Again, just waking up feeling drowsy. So vitals were stable, other than his body mass index was 30.5, so clinically he would be obese. Physical exam was normal, other than being obese, and his PHQ-9 was a 3. So differential diagnoses, just obviously based off of fatigue, and then kind of from his history. One of the main ones and the top diagnoses would be obstructive sleep apnea, or I guess it could be central sleep apnea, depending on what's triggering it. And then hypothyroidism. Depression would have been an initial one, but then with the PHQ-9, it doesn't necessarily reflect that. And then anemia. Sorry, my phone cut out there for a minute. Took me a minute to realize, but and then other potential differentials, just with the history of cancer, prostate cancer, obviously that could be a potential different diagnoses as well. But those would be kind of my main ones. So diagnostic tests would be, so the labs, some of this would be due to his yearly exam too, but so PSA for prostate, lipid panel, CMP, CBC, A1C, urinalysis, B12, vitamin D. And I have the results of those ones, and those were all within the normal limits. So his thyroid stimulating hormone was elevated at 4.5, and his T4 was low at 4.4, signifying hypothyroidism. And then also I ordered a sleep study for this patient, again, to check for sleep apnea, which, still hasn't taken place. So treatment for this patient, for the hypothyroidism, we'd start him with levothyroxine at 25 micrograms once daily. And then if he is diagnosed with the sleep apnea, CPAP or BiPAP, depending on what's going on. Education for this patient. One of the main things that can help with not only his sleep apnea, but hypertension, hyperlipidemia, would be weight loss, and diet. Those would be very important to help kind of combat some of those things that he's facing. The weight loss and diet can help with all of those. And then follow up with the patient. I would follow up just in about 4 weeks to reassess the TSH, and see where he's at with his dosing, which we could increase as needed, basically with the levothyroxine. So yeah, that's this patient this week.